It's just a huge honor for me today to be podcasting and interviewing Erin Doffoney, RDH, BAS, the BAS Bachelor of Applied Science. Erin's passion is to bring skill, comfort, and care through dental hygiene. Her goal is to focus on patients who've had compromising dental experiences. There have been situations where some patients have gone untreated for extended period of times, which allows her to help patients find healthy perceptions of themselves and strengthening their confidence. Erin knows there is no single approach that is right for everyone. Her vast experience in the dental field since 1995 includes a range of modalities consisting of soft tissue management, paradigm shifts in technology, clinical behavior, as well as clinical verbiage and techniques. As the founder of Techs for Teeth, Erin has become particularly sensitive with coaching individuals and helping them structure an action plan, clinical excellence through teamwork, perfecting team efficiency, understanding your why, and team mission statements that aid in patient and clinical proficiency. Erin's educational and professional background includes a Bachelor of Applied Science degree from Clayton College and State University in Atlanta, Georgia, dental hygiene board certified and licensed in Georgia and California with certification in local anesthetic, nitrous oxide, and curettage from Southwestern College in San Diego, California, a proud member of the American Dental Hygienists Association, National Association of Professional Women, and a sponsor of AACD Give Back a Smile program. My first question for you is, you're from Atlanta, Georgia. Have you recouped from the Super Bowl yet? Or are you still in therapy?
You know, can you believe that?
At halftime, I would have bet my house, car, 4 kids, and grandchildren that they were going to win.
The Falcons were going to win, right? Can you believe that? At the last, I mean, it was just unbelievable.
Can't believe it. That's what we share in common, because when the Arizona Cardinals went to the Super Bowl, they were winning. The street was crazy. We were already celebrating, and with 1 minute to go, those damn Steelers threw a Hail Mary pass, and the street went silent.
Yes.
Oh, my God.
I know. Now we have a new stadium, so they're going to have to redeem themselves. They're going to have to come back from that and win it for the new stadium. So we'll see.
So I called you. You didn't call me. I'm a big fan of your website, textforteeth.com. I've watched you on YouTube videos. I just think what you're doing is amazing. Tell us your journey. What was your journey on becoming a dental healthcare provider?
Well, it started, you know, we all have this big dream of graduating from high school, going on to college. So went on to college, went to the college that my mother and father, aunts and uncles, everyone went to. And Dr. Farran, I was completely lost. Changed my major a couple of times and went on to kind of explore who I was. And I figured out something about myself. I like working with my hands. And I know I like talking to people one-on-one. So my first thought was, well, let me go into nursing. And then I thought about it. I was like, well, I really don't want to work holidays and weekends and 11 at night to 11 in the morning. So then I paralleled over to dentistry, and I found my passion with that. So went on to dental assisting school to make sure that it was right for me, because I wanted to have a base and a foundation. And the journey started there.
And where along your journey did you come up with textforteeth.com?
That came up probably about a year ago. To make a long story short, Techs for Teeth, Techniques and Technology, I'm a techie girl. I love everything technology. If you look at my purse now, I have every wire to go with every device, and I carry it around with my Apple computer and everything else. I don't want to be left without any of my technology, so I can keep moving forward.
So you're a nerd and a geek?
I'm trying to be. I'm trying to be, but that's, and the teeth, you know, obvious thing with the teeth. I'm a hygienist, so I just married the two together, and here we go. I love everything technology, especially in the operatory.
What technology do you think, what technology are you passionate about today that they didn't have 30 years ago when I got out of dental school?
Well, I'm glad you asked. I am obsessed with using the Care Review by Dexis. It's a transillumination technology. It can actually transilluminate tooth structure from the lingual and the buccal side, so it can transmit light up to the tooth, so you can actually see decay a lot sooner than you can with X-rays, but it's in conjunction with digital X-rays. I think it's great. It's one of the best pieces of technology I've used in my 17 years as being a hygienist. 22 years total, actually, if you add assisting with that.
So Caravue, C-A-R-I-V-U-E?
V, no E. It stops at the U.
C-A-R-I, there it is. Dexis. Here, I'm pulling up on the web now. So tell us about Caravue. Is it very common? I mean, what percent of dentists right now and hygienists do you think use Caravue by Dexis?
I'm not sure of the percentage of how many people use it. It's pretty popular. I've been accustomed to it for about 3.5, 4 years now, and I can tell you that a lot of patients like it because it takes some of the worry out as far as a lot of radiation exposure. People have a big concern about that. So the Caravue kind of eliminates that concern a lot, especially with young children. Parents don't like to have their children with a lot of X-rays, so it's good for them as well.
So how much is this Caravue transillumination technology?
It'll probably cost you about $6,500. But trust when I say if it's used every day, you got to use it, and you're really proficient in it, it'll most likely pay for itself in about 2 months.
Yeah, I love it, and I love those the pictures they have on their website.
Yes, that's it, exactly.
And with humans, I mean, let's say you and I met at a party, and you tell me your name is Erin, and an hour later, a human, their ear doesn't remember, so they walk, but their eyes know it's you. So they walk back over to you and say, "I'm sorry, what was your name again?" You say, "Erin Doffoney," and then you give me your card because my monkey thumb can hang onto your card, but my ear can't hang on to the sound. So seeing is the way you communicate with humans, and when they see that cavity, I mean, I think anything visual. That's why I like digital X-rays, because they can't see the little Kodak film. That's why I like intraoral cameras. That's why I like Caravue. I mean, if a human being sees, they understand.
I'm all about seeing is believing. It's an old term, but seeing is definitely believing. You show people what's going on. You make a story about them, and then they can relate to their own story as far as data collection. Seeing is believing. I truly believe that.
Yeah, and I like that study on their website that visual inspection of interproximal decay, you can find 2% of them. And with Caravue, you can see 96% of them. And the thing about X-rays is, I mean, how many times do you take bite wings and the bite wings aren't perfect? They're not an open contact.
Right.
They're, you know.
And not only that, Dr. Farran, don't mean to cut you up, but not only that, a lot of times insurance is limiting us, because a lot of people are insurance driven, is limiting us to one time per year where we can get a whole series. But with Caravue, you can use it every day if you like.
Right.
And it doesn't have the exposure with it, so.
Yeah. So besides Caravue, what are you passionate about? What other technology?
As you mentioned before, the intraoral camera, the digital X-rays. I'm all about making sure that people can see what's going on in their mouth. And even in the office that I work in now, we use an iPad, so we can sit shoulder to shoulder with the patient. They can actually move the picture around on the screen themselves. They can expand it themselves. So that's a good little tidbit to have in offices as well.
Do you have a name brand on intraoral cameras or digital X-rays, or are you agnostic towards those?
I'm just whatever works. Whatever can relay the picture, as long as you can get a good quality picture, and a lot of different type of techniques going into making sure that you have the right picture. For example, when I'm taking intraoral camera pictures, I want to make sure the overhead light is out of the way, because then it ends up putting too much light onto the tooth and you really can't see the contrast is not that well, from what I've experienced.
What I do is I take the overhead light and I bounce the light off my bald head, and it spatters it all over the room. It's Looks like a laser show. So what are my homies going to find on textforteeth.com? If they went to textforteeth.com, what are they going to find?
They're going to find information about me, of course. They're going to find different services that I provide. Can go in, I can help you out with some temping if you like, some other services. I'm starting to do some speaking engagements and some presentations. And if you like for me to come into your office and help your staff members try and navigate on how to use all of this technology within a certain time frame, because I know that's hard sometimes. We have all this technology in the office, then we try and figure out, well, how am I going to get it into my hours or 45 minutes worth of time that I have with my patients so I can relay the whole story.
You need to brush your teeth every day. You need to floss every day. And teams need motivation every day. And some people say, well, I took them to a seminar and it was all good for 2 or 3 months, but then it went back to normal. I said, well, you don't say that about brushing, flossing, or bathing. Well, I took a bath and I was really good for a month or two. Then 3 months I started to stink again. Teams need motivation. And I think the hygiene department is the stepchild of the dentist. The dentist is always wanting to go to courses that are for dentistry. And a lot of hygiene departments are thrown on the back seat, and they're the foundation. I mean, I was reading an article yesterday by an ophthalmologist, and he said that he was so jealous of dentistry because the biggest problem in ophthalmology is people don't have that 6-month checkup and they're not coming in. And he said dentists were the best because they developed this program where they get all their patients to come in once, twice, 3, 4 times a year. And in ophthalmology, some people start developing serious glaucoma and all these issues.
They may go once every 5 years or so.
Yeah, and by the time they come in, they're sitting there thinking, oh my God, if only I could have diagnosed this 3 or 4 years ago. So I'm a big fan of getting you in front of more dental offices and hygiene teams because, like I say, it's the overlooked stepchild of dentistry when it comes to CE. So you talk about learning new technology techniques can be daunting, whether it be software, caries detection services, digital impression scanners, or emotional dentistry. It's all necessary for building the patient's oral health story for them to review. You talk about create a diagnosis cycle for optimal care. Talk about what is emotional dentistry and what is creating a diagnosis cycle for optimal care.
So emotional dentistry, if you have software within your office that can actually simulate a different smile for a patient. Patient may come in, they don't like their smile. We all know a smile is good for self-esteem and just putting people more out in front of people. If you have a software where you can, in your office, you can take a picture of a patient, put it on the screen, and then put different teeth in there to kind of simulate what they may look like, and then you can print off a picture so this person can take this home and then they can muddle over, hey, I might want to look like that one day. So that's what I mean by emotional dentistry. You catch the emotion of the patient, what their needs and what their concerns are, and you turn it into a want.
Now, are there any technologies you like that help do that?
Stick to the basics. Cameras. Be very good. Be very proficient at taking photos, regular photos, because you have to upload photos into the software to make sure you can get the right teeth in place, the right coloring in place. So you want to make sure that everyone in the office is trained properly on getting the right photos.
You know, and photos is really the basis of marketing, because when you look at dental office websites, the average dental office website only has a 5% conversion. So 20 people have to land on your website before one person calls the dental office. And when dental offices have a YouTube video of the dentist or the team or the hygienist talking, it makes them feel something. That doubles the conversion from 5% to 10. If they have an online scheduling deal, that's another 5%. If they have a chat box, or a little deal pops up, and you might look at that chat box and say, that's stupid, I would never do that. Well, it doesn't matter, because if 19 out of 20 people don't do it, I don't care about that. I care about, it gets one more out of 20. A YouTube video of you on the website gets one more out of 20. Online scheduling gets one more out of 20. But pictures are huge. And when they start putting up before and after cases and pictures, I know dentists who got serious about their website in doing cosmetic dentistry or implant dentistry or whatever, and now they have people flying to their office from Southwest Airlines, and they'll tell me, this guy told me the other day, he goes, this guy flew from Wichita, Kansas, to Kansas City to have me do the case. And when he left Wichita, 4 of my best friend diplomats in the International Congress of Implantology were in that town. He flew over a bunch of other diplomats, and they just didn't know that these dentists that were literally in their zip code 67212 were actually so good in implantology that he would have them place implants on himself. But you go to their website and you don't get that. You don't.
Right. You don't know. A lot of times you just don't know. Your regular dentist that you go to, you might not know that this is what they do. Or, for example, some patients come into the office, but then they want to go to this other dentist saying, oh, but I didn't know my dentist does cosmetic dentistry. It's very important that you highlight the things that you do in your office and do them efficiently and do them well. You want to make sure of that.
Yeah, I have sent several patients back in the last, my 30-year dental anniversary for my dental office was yesterday, September 21st. 30 years we're open here in Phoenix. And I've sent 10 or 20 new patients back to they'll come in and they want like an implant consultation or whatever. And I'm like, I say, well, who did you just move here, or how did you get my? Did you just move here? No, I lived here, 30 years. I said, well, so who was your last dentist? Oh, I've been going to so and so for 10, 20 years, and I'm like, well, actually, he is like 5 times better in implants than I am. And why didn't you ask him to do it? And she says, well, I had no idea that he places implants. And I go, dude, he's like one of the best implantologists in all Watuki. Crazy how your own brand or what makes you all about, you just don't feel that from the dentist website.
Well, and not only the dentist website, but you have to get out there and network yourself. You have to. Whether it's, again, making a YouTube video, speaking about it for 5 minutes, plugging that into your website, you have to put yourself out there and make yourself noticeable. Seeing is believing, hearing is believing. Like you said earlier, we don't always continue to catch on or grasp what we hear, but if you're seeing it more, all the better. You have to put yourself out there and network.
Yeah, everybody says your network is equal to your net worth.
That's a good one. I believe that. And how much you put into it is what you get out of it.
The only people I know crushing it in sleep medicine are the ones who went out and visited every physician within a 5-10 mile radius of their office.
You have to, Dr. Farran. You have to put yourself out there to say, hey, I'm down the street from you. Let's collaborate on this idea. What do you think about it? That's all you have to do is ask. That's all you have to do.
And my biggest referral has always been from the pharmacist. No one ever pays attention to the pharmacist. I've had every one of them to my home for dinner, wine, whatever, because people always go to Walgreens or CVS and they go to the pharmacist. They go, "What's best for a toothache? Would you get Ambisol, or would you take Motrin or Excedrin? What would you take for a toothache?" And they say, "I would go see Howard. Go see Howard Farran. He's right by Safeway,
and he can give you all the advice you need." That's a good point.
And those pharmacies are open. Some of them are open 24 hours a day, and they know me. They go, "Look, if Howard's asleep, his phone's turned off. So it doesn't matter if it's on Sunday. Just call him. That's his actual cell phone. Just call him or text him or whatever. And and I also think dentists are so much better businessmen than physicians, because like when I try to when I go to like a new physician moves in, I mean 80% of the physicians' websites in Ahwatukee don't have an email on the website. They don't have a contact form box. The only way I can, I have to call the number and then ask the whoever answers the phone, can I have a cell phone number? They almost always say no. It's like, really, a doctor in the same zip code, you wouldn't give him a cell phone number? Well, I would have to ask. Well, just give me his email address. Well, we don't give out his personal email address. I'm like, dude, he's a cardiologist. We're in the same. I mean, are you out of your flipping mind? Does he not want patients? I mean, it's almost like physicians go out of their way to not be accessible. I mean, dentists. I'm always being hard on dentists, saying they got to do better. But man, compared to physicians, they're the genius child, and the
lock and key. They're under lock and key. They are inaccessible. You cannot touch them. You have to probably go through 5 channels just to get to the cardiologist.
Isn't that bizarre?
It is bizarre. It is. It's very bizarre.
Yeah. I love your website. You also talk about on Tex for T, TECHS, Tex 4 Teeth, and 4 spelled out FOR. So tex4teeth.com. Action analysis. Effectively incorporate action within the dental team. Do you want more positive connections with your patients? Taking action is not only movement towards a specific object or goal, but it's a mindset. What are your thoughts on action?
My thoughts on action is that you have to know what action means. We all know that action is movement towards a particular path, whether it's mentally or physically, we know that. But you have to break down action as an acronym and plug in what you want that acronym to mean, and then follow that. So that's the whole analysis that I come up with people. So I'm like, well, what's your action? Well, okay, I do A, B, C, and D. Well, break that down for me. What does that really mean? We know action is movement, but how do you go about that movement? So that's my action. I help people go ahead and figure out what action means to them by breaking action down as an acronym.
Well, I want to take this interview to a whole nother discussion. We'll take it to the other side, because you're very motivational. You're very your Carmen energy is amazing. But a lot of dental offices are burned out. There's a lot of hygienists out there listening to you right now. A lot of dentists out there saying, "Look, the only reason I'm going to work as a hygienist or a dentist is because if I threw my dental license away, I can't make this kind of money." Without my hygienists make $40 an hour. If they threw away their hygiene license, what's the chance they could go make $40 an hour? And these dentists, they always complain that the average dentist only makes $175,000. I'm like, well, dude, shred your dental license. And what do you think the odds are the average dentist could go find a job in Atlanta making $175,000 a year?
Right.
He'd find he'd find 3 unicorns and meet the tooth fairy before he found that job.
With a little fairy dust sprinkled into it.
So what would you say right now to hygienists and dentists listening to you burned out, saying, they're asking like, why are you so motivated? What are you on drugs? I'm burned out and fried. Why are you so happy?
You have to figure out why you got into it to begin with. Now, if your reasonings of why you got into the field to begin with was short term, then you're right, you're going to get burned out. But if you go into dentistry with the notion of knowing that I want to help people, but also form relationships at the same time, then it's a no-brainer. Form relationships and inform people at the same time. You have to know you're going to have some aches and pains. Your back is going to hurt. Your neck is going to hurt. Your hands, all that is going to hurt. You're going to be worn out at the end of the day. But with that being said, at the end of the day, what did you do? What was your purpose? Did you accomplish it? You have to ask yourself those questions. You have to ask yourself those questions, Dr. Farran, because you need to understand, if you're in it just for the money, you are going to get burned out real fast. When I was in hygiene school, I used to hear it often. Well, I want to be a hygienist because I like the money and I like the schedule. And I remember saying to a couple of colleagues at the time, well, how long are you going to stay? Don't you want something else more than that? You're not only treating teeth, you're treating people that are attached to these teeth. And you have to remember that. And I think that's where we get all bogged down in this whole thing, that we are only focused in on the teeth and we're not treating the people attached to the teeth. I've had instances this week where I probably cleaned somebody's teeth for 20 minutes, but we talked for 40 because they were going through some things. And you have to learn, you have to be able to do those things, number one, for retention. And we know we do want to make goal and production and all those things that go along with it. But, we're all connected in some kind of way in this world, and you want to make sure that you are connecting with your patients in some sort of way, because if not, guess what? They're going to go on to the next office. They're going to find their connection somewhere. So read body language. Listen to what your patients are going through. If you can help them with something else besides what's going on behind their lips, guess what? That patient will stay and continue to come to you. I've heard it over the years. Erin, I feel like I can talk to you. I'm comfortable with you. You have to make these people comfortable with you. And, you'll be rewarded at the end of the day. You will. If you're in it for the right reason, you have to make sure you are in dentistry for the right reason.
I think it's so amazing. You'll look in some new patient's mouth and they'll have say one bridge or one gold crown. I'll say, who made that gold crown? They never ever remember.
They don't remember because you know what? Maybe the connection wasn't there.
Yeah, they never remember what you did. They only remember how you made them feel. And when you talk to so many patients, I always do a psychological exit exam when they come to my office. I say well, did you just move to Phoenix? I mean, where do you move from? Oh, no, I lived here 20 years. Well, have you gone to the dentist the last 20 years? Yeah, well, why did you not go back to the last one? And it seems like more times than not, the number one reason is somebody in the team made them feel bad. They talk down to them. They're condescending. And what's really weird is even the business. I know so many dentists that when someone hasn't been in their office for 5 years and walks in unannounced with a toothache, they're like, what a pig. I mean, he hasn't even been in 5 years and he expects me to drop everything and see him. And it's like, well, first of all, it's a root canal buildup and crown. It's $2,000. If Santa Claus came down the chimney and put $2,000 in your stocking, would you say that's stupid Santa Claus? And furthermore, everybody needs a doctor. Okay, so you have patients who don't come in. I mean, that's no reason to make them feel bad.
That's right, exactly. And they're coming to you. They made that first step. So, applaud them, champion them for making that first step, and then just go from there. You have to make people feel comfortable. Your bedside manner is gonna determine if those patients are gonna continue coming back to you.
Oh man, I would. When kids are in dental school and they think, well, if I own my own office, do you think I'll be successful? I always tell them, well, almost all of it is your chairside manner.
Yes.
I mean, if you're warm, loving, caring, smile, passionate, empathy, sympathy, you'll crush it. But if you're a librarian geek that is condescending and doesn't connect with people, it's going to be tough.
You know what, Dr. Farran, before I got into hygiene school, I was working as a dental assistant. And the dentist I was working with, I have always held on to this one piece of advice that he gave me. He said, Erin, you know what makes a good hygienist? I said, okay, what? Give it to me. Tell me. It's 30% skill and 70% personality. If you can hold on to that, you'll do fine. And I've held on to that for at least 17 years now, and it's true. It's true. Until you get out of hygiene school and you learn your style and you figure out who you are in this operatory and and how you're going to figure it out. And once you calm down a little bit, you realize that, you know what, the skill is there, we learn the skill, but if you don't have that personality to capture that connection, you got to have it.
Oh my gosh, you can't believe how many dentists I know who are really below average technical dentists who do $1.5 million a year and take home $350, because when you walk in that office, it's just energy, it's karma, it's balloons, it's just, they just crush it.
I'm happy you're there. Thank you so much for coming. I have to attribute this particular statement to a cousin of mine, that's Desiree James. She's been a hygienist for over 25 years now. One particular statement that she always says is, take your ego out of the operatory. If you can take your ego out of the operatory, everything will be fine. I believe that.
Yeah, and you know, I have patients that come to me in a wheelchair with oxygen tubes in their nose, and they're out by the front door smoking cigarettes before their appointment. And some people see that and they start getting all judgmental and condescending, and she's an idiot and blah, 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 blah. And it's like, I mean, you don't do that when you go to the zoo. You don't look at a giraffe and say, why is that giraffe being an asshole? And you don't.
And just standing there and looking at me. Why, yeah.
I mean, why people are zero judgmental to their dogs, cats, and goldfish and all the animals at the zoo. And then here's human. They're Homo sapiens. They're an animal. But they're so judgmental towards their fellow humans. And I just think it's all an attitude. I mean, I hire on attitude and train for skill. I can teach you how to do technical stuff, but I can't teach the attitude living between your ears.
And you know what, Dr. Farran, where it starts? In the huddle, the morning huddle. I believe it. If your morning huddles are not constructive and not upbeat and happy, then guess what? You're kind of going to be down the tubes for the rest of the day. And not only that, you're just focused on making the money. You're not focused on the people that are actually in the chair, and we have to get back to that.
Yeah, they're focused on making sure everybody pays, but not making sure everyone stays.
Correct. I love that. Yeah. I mean, they're focused on looking at the day sheet or looking through the charts. Oh, let me see how many crowns I can get out of this person. Yes, if they need it, treat it. But remember, the patient didn't do it for some reason, because there's some circumstance, and you have to be empathetic to that. You have to learn how to have some empathy somewhere.
And I think I like the word empathy better than entrepreneur, because if you really look closely to entrepreneurs, they have a high degree of empathy because they see you need something, so they build a company trying to get you what you need, as opposed to them making something and then trying to sell it to you.
Right? Exactly.
It's like, I'm not selling you something. I have empathy, and I create a whole business trying to get you what I think you really, really need.
Correct. And making sure that you're happy along the way while I'm providing that need for you.
So,
absolutely.
So tell me, what do you like to do more? You like to speak to study clubs? You like to go into office and do consulting? What do you like to do? Do you put on programs in dental offices? Talk about how you get out there and help offices.
Well, right now I'm keeping it small. I want to grow bigger as far as doing presentations in front of larger study clubs, because you have to get the message out there. Like you said earlier, so many people in the dental office are burned out. We have to get that momentum and that motivation and that action back into play. So if I can start small with that one person, that one assistant that is just always getting fussed at, foot put on their neck, they're not doing anything right, I'll start there. If it's in front of a group of 500, let's do it there as well. But we need to get back on track on as far as putting that motivation and putting that feeling and that empathy back in the right place. It doesn't stop when you hit the door in the morning and then when you leave, because when you go home to your family, friends, dog or cat, you're going to treat them better than you treated the patient actually giving you $2,000, $10,000, $30,000 for this service that you're providing to them.
One of the problems you talk about the I'm talking about a hire on attitude, train for skill. You're saying it all starts in the staff meeting. How many of these offices do you think one of their biggest problems is that on that team somebody is not a team player, somebody is toxic, someone is a morale booster? Do you think that's very common, or not very common?
Very common, highly common, highly common. And I believe sometimes when you're interviewing, both for the leader and also the person looking to hire the job, you need to know what you're looking for. You need to know what talent that you need to place in that office. And matter of fact, when you are interviewing for a job, you need to have a good understanding of what that office needs. So it works both ways. But I believe, that old saying, one bad apple can ruin the bunch. Don't be that bad apple.
Well, it's so bizarre because every time I've ever had a dental office consultant come on the show or met one or whatever, and I say, when you go into an office, what is the biggest, most common problem you see? And they go, oh my God, I'm lucky if there's just one toxic person. Sometimes there's two. And you talk to someone who's done this 10, 20, 30 years, about every decade, they have to go in and fire the entire flipping team and start from scratch. They say, and now what's amazing is, these big corporate dental chains, they used to just prefer to just go out and acquire practices. They would just roll them up, get a big line of credit and go buy them. But now they're all switching to starting new ones from scratch, just because going in and buying an office and getting rid of the toxic people and turning around the morale, they've just found out through trial and error of the last 10, 20 years that, we'd rather start an office from scratch and lose money for 6 to 12 months than go in and buy Henry's office and deal with the crazy toxic blah 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 blah. I mean, so why do you think this is this problem is so common and allowed by dental offices owned by dentists?
Dr. Farran, you know what? I believe you have to find that common denominator of who is the toxic one. It usually starts with one common denominator and it trickles down. Water flows downward. So you have to address the problem with the initial toxicity, if you will. And if you can try to hone in and fix the initial problem, the root of it, where it starts from, then morale can change. I truly believe that. But people have to be, let's be clear, people have to be vulnerable and transparent on what they think their own issue is so it can be fixed. And it's no problem with being vulnerable. A lot of people are afraid to do that. They shouldn't be. But in order to remove the toxicity, because guess what? If you are toxic, your patients are going to be toxic. And then that's why you keep complaining when Mary Sue comes in and she's smoking with her oxygen tank and it needs to be sitting right in the chair and it's in your way. Well, if you look at it differently, you take your own toxicity out of yourself, then it could be the better for everyone. But you have to figure out what the common denominator, or who is the common denominator with that toxicity in the office. And it can start right there.
Yeah, and the other thing I always see in dental offices, the dentist, is in the operation for an hour during a root canal. Then as soon as she's done, what does she do? She gets up, she goes to her private office and shuts the door.
Yeah.
It's like, man, you have your biggest expense is payroll. You have a whole team out there. Right now, the assistant and the hygienist are slugging it out in the break room, and your receptionist is up on letting calls go to voicemail while she's surfing Facebook. Why aren't you engaged with your number one investment, your number one expense? Why aren't you engaged with your team?
I ask that question all the time. Where's the disconnect? Are we all just minions, so to speak? No, we're all individuals with separate lives. We're all there together. Matter of fact, when you're in the office, you probably spend more time with everyone that you're working with than you do at home. So you have to nurture those relationships, collaborate. Everyone might not like doing the same thing, but you have to have respect for what's going on in the office and understanding, making sure gaps are filled where they need to be filled. But you're right. Don't talk down to anyone. Let's all be positive. If someone has a problem in the office, or they're going through something, maybe a death in the family, or they're just not financially making it, don't go in your little corner with your clique and start talking about that person badly, and then that's how things snowball. Let's help each other.
I can't believe it. Sometimes I can't tell you how many 100 times I've been at a dental convention or lecturing or whatever, and I'm talking to some staff member and say, well, who's your dentist? And the first thing they do is roll their eyes. They roll their eyes. And that guy back there in the blue shirt, I'm like, oh my God. Right. Either you need to man up and quit an office. You shouldn't be working for someone that when someone says their name, you roll your eyes and just. Right. If you do something every single day that you don't like to do for money, that's going to lead to disease and depression and alcoholism and kicking your dog and drowning your goldfish. You shouldn't do things.
Yelling and not be, constant headaches and body aches. All that stuff makes we're going to get aches and pains. I said that earlier. But all that stuff, not being well or doing the right thing makes your body hurt even more.
So do you like to go into offices and what do you do when you go into an office? Do you have them closed down and you lecture for 2 or 3 hours, or do you work with the office while it's running, or talk about your consulting services?
I like to go in and see them at their norm, see what's going on, kind of go in and hey, I'm not here to judge, just do your thing. I want to see how your normal day is, and then at the end of the day or at the end of the second day, we can go in and talk about, okay, here's what I noticed. How do you think that could be better? I'm not there to dictate to you on how you should run your office, because people go in, consultants come in, they're there for a day or two and they leave. So what you need to do is go into an office and you have everyone else tell the consultant what you think how your office should run. Because it happens a lot. Consultants come in, like I said, you stay for a day or two, kind of hurricane things up and leave you with the mess and you figure it out. And I don't think it should really work that way. I think the office should decide how it should run. But again, you need to figure out, let's work out the toxic stuff first. Let's get that on the table. Let's off the record, get it on the table. No one's going to have any judgment. No one's going to be mad at you next week because you said such and such about Mary was acting this way to Sally Sue. Let's not do that. Let's get it on the table. Let's leave it here. And let's talk about how you want your office to run.
Textforteeth.com, on your blogs, you got a share button. I love that article. 3 things patients look for in their dental care provider. And you got a picture of my buddy, Jack Nicholson.
He's Shining, right?
And The Shining. And I just retweeted that. Because right now everybody listening to you is they're driving, so I retweet my guest on @HowardFarran. So I just retweeted that one to 23,000 Twitter followers. Thank you so much for following me on Twitter. It's free, it's cheap, it doesn't cost me a penny. But talk about that article. You talk about 3 things patients look for in their dental care provider:
creativity, honesty, and being organic. That means being yourself, telling the truth about what's going on as far as what needs to be done, and being creative. Don't always give that patient the very low end treatment plan, and then you skip to the very high end. Make sure you're giving that patient something in the middle, and if we can't figure it out. Patients come to you for your expertise and your creativity. Give them that.
I'm 55. I got grandchildren. People my age are on desktop dental town. The dentists and hygienists that download the app, they're millennials, and so podcasting is more a millennial thing. Like most of my friends who are 55 to 65, they don't know what Yelp is. They don't know what a podcast is. They don't know any of that stuff. But these young kids, they come out of school and they're sweet and they're shy, and they just can't tell. They just feel bad telling you, Erin, you have 11 cavities and I can't do a regular cleaning and you have gum disease. They just they just go to, well, let's just go to the tooth that's bombed out and has to be pulled or a root canal. And they do one tooth dentistry because they're too sweet to tell you that your whole barn is falling down.
No, you know what? That's where the organic comes in. Be yourself first. Matter of fact, ask the patient at that new patient exam, do you want me to be completely honest with you in everything that I see? Get that permission from the patient. And if that patient says yes, be yourself. Tell them what's going on. You have to make the patients aware of what's going on. So that's where the whole thing of being organic comes from. You want to make sure you're being yourself. And again, forming these relationships, because people are going to have more respect for you being honest with them. Be honest with them and tell them the truth.
Man, this is a marketing day bonanza for you. I just retweeted another one of your amazing articles to 23,000 on Twitter called "What do you mean I have bugs under my gums?"
Yeah. How do you like that one?
and I just posted it on Facebook too. But talk about that one. What do you mean I have bugs under my gums?
Well, in the particular office that I work in, we have a microscope. It's all
nice.
It's all for validity. So if you're coming in as a new patient, guess what? I am going to take a plaque sample, and we are going to go to that microscope together, and we're going to see how much motility you have going on. And you can just imagine the expletives that I get from people when they see how much activity they have. And it's not to scare them, but it's just validity for us as oral health care providers to say, hey, this is what's going on. That bacteria is real. This is what's causing that bleeding. This is what's causing that bone deterioration. It's real. It's here. You can see it for yourself. You saw me take the plaque, your plaque, put it on a slide. We went to the microscope together. You were with me. This is real.
Do you know who started the microscope?
Who did? Who started?
The using a microscope in the periodontal.
I know it's been around for years.
Well, it was Paul Keyes. It was the Keyes technique, and he just died February 20th of this year at the age of 99. And Ryan, I still have the biggest regret about that, because when I started my podcasting, I tried to get Paul Keyes on there, but basically he was, he was, when I started the show, he was 98. They're not on Skype or anything, and I couldn't really find anybody to go do it. And then when he died, I thought that was so dumb. I should have flown out there. We should have flown out there and got this guy. But he was a legend to so many, because and I don't know why I did this 30 years ago. You use it today. I need to get back into that, because Omar Reed was the one who showed me the Keyes technique first. But you would take like a toothpick on a slide of someone clean, and you could see the bacteria, and everybody thought it was cool. Right. But if you were really healthy, the bacteria all looked like they were sleeping.
Like right.
And then you put some on there with someone who had perio, and the bugs were doing backflips and somersaults and jumping jacks, and it was a very powerful teaching technique. Yes. And I don't know why I stopped doing that, but you're doing it in your office?
I'm doing it in my office. Absolutely. It's all about validity. Seeing is believing. Remember we talked about
that? Absolutely.
Seeing is believing. And A lot of people give you this excuse, oh, well, my gums have always bled. Well, okay, it might be common, but it's not normal. Bleeding is common, yes, but it's not normal to bleed. And I always give people the analogy of, if, especially ladies, you go and get your fingers manicured and your nails done, if they're pushing back on your cuticles, if you start seeing blood, that will be a problem, right? They were like, absolutely. So it's almost the same thing. You know, your gums are not supposed to bleed. If they bleed, that's a sign of active disease and infection. And we need to take care of that.
Man, I wish you'd make an online CE course for us on Dental Town. We've millennials,
Well,
old
let's
guys like me, go to conventions, and
uh
every convention has been complaining for the last 10 years that their annual attendance just keeps drifting down and down and down and down. And it's because it's moving to online. We put up 450 courses on Dental Town and they're coming up on 1 million views.
Wow.
But that dentists always want to learn the technical stuff on how to do root plane curettage, how to do a root canal, but they never want to take a course on, well, how do you sell? How do you get the person involved? How do you teach? And
Right.
that microscope, that keys technique, that is just that is a rebirth in dentistry.
And you know what? And the funny thing about it is, patients end up teaching themselves because they see all of that going on the screen with the microscope. You have it hooked up to a laptop or a desktop computer, a big enough screen so they can see everything going on. And they start teaching themselves. They're like, okay, I'm going to get better. You don't have to show me that again. And especially when I tell them things, well, you know, a lot of this can be transferable. So if it's going on with girlfriend, boyfriend, guess what? You know, you might be having the same bacteria. So that kind of gets them on board as well.
I can't believe, you know, in I got out of school in '87, and that was right. You know, the first guy that died in my dental school class actually died of HIV/AIDS.
Okay.
That was the first class member we lost. I still think it's bizarre that now I've been out of school 30 years, and the whole planet, because of AIDS,
Uh-huh.
understands disease transmission below the belt. But
Right.
today, it's still, the whole planet doesn't get that you can't treat grandma every 3 months for periodontal disease, and you never seen grandpa, and they're
Right.
kissing each other every night. And then
Right.
grandpa shows up and he's got a bombed out molar, he's got 9 millimeter pockets. It's like, well, would this dental office, would you have treated grandma for gonorrhea every 3 months for 10 years without
Right.
ever asking to see grandpa?
Exactly.
And when you tell patients like that, I mean, even patients like really, I can catch decay. And what I tell them is, I said, okay, if you went out in your backyard and you saw a giraffe,
Right.
I mean, wouldn't you first ask, where the hell did this
Where
giraffe
did it
come
come
from?
from?
Could could
Right.
could would you ever go out in the backyard and think, wow, that giraffe just evolved in my backyard out of nothing? That giraffe came from a mama and a daddy giraffe somewhere, and
Someone.
when you're born, you don't have in your mouth Streptococcus mutans that causes cavities, P. gingivalis, HIV. Your babies aren't born with chlamydia. They're not,
Right.
I mean, this all comes from somewhere. And so you have to treat a family. And when you start talking to a family, my biggest passion is when a little girl comes in and is pregnant. And I learned
Right.
this from the only people that got religion on this are in Austria, Germany, and Liechtenstein. It's the only place they're obsessed with. They get this girl in there and they say, look, you're pregnant with a baby, and there's
Right.
herd diseases. There's most of these diseases your baby's going to get its whole life are going to come from another monkey in the herd.
Right.
So
Right.
I need to know I need a complete list of who's going to kiss this baby, share a spoon with it,
Put
blow
the
on her food.
pacifier in the mouth, and then put the pacifier in the baby's mouth. Come on.
Oh, I know, and they'll get the entire family all checked out. they will culture their saliva to see if they can culture Streptococcus mutans out of their saliva. And the company that sells that technology is Ivoclar. Ivoclar won't even market it in the United States because no one will even buy it. They said the only people that understand epidemiology in dentistry live in Liechtenstein, Germany, and Austria. And you go talk to a dentist in Austria, and he'll say things like, I have 1,800 patients, and 600 of them are under 18, and 400 of them still don't test positive to Streptococcus mutans. And then in America, you have a newborn baby, you hand it to your grandma who's got an upper partial, lower denture, hasn't had a cleaning in 6 weeks, and she gives it a slobber kiss right on the mouth.
Right.
And you can start training these little pregnant girls that say, don't let grandma or grandpa kiss this baby unless I've seen them and can tell you they're disease free. We don't want to transmit. Last question. I can't believe we've been yakking for an hour. My God, that was a fast hour. I want my last question to you is my biggest passion is when they talk about the oral health continuum. America is about money's the answer. What's the question? I listened to United Concordia. Their dental director used to be the dentist at the executive director of the American Dental Association. But they were saying the most expensive thing on the oral health continuum is that pregnant girls with gingivitis or periodontal disease have preterms, and the most expensive thing on a health insurance free, if you drop a 1 pound baby. At the minimum, that's going to cost me $1 million. That baby's going to be in ICU for a year. And so they're starting to realize that when they're insuring young girls in reproductive years, that it's cheaper to cover your cleaning, exam, and X-ray because they don't want you to drop a premature baby. And I think that might be the first oral health continuum where medical insurance companies saying, if I'm going to cover Erin and there's any chance she's going to get pregnant this year, she's got to get her teeth cleaned. How close do you think we are before getting health insurance and dentists and hygienists to really realize that the money spot is a pregnant girl because we don't want her to have the baby and then let grandpa kiss it on the mouth, and we don't want her to drop that baby out of the oven because of periodontal disease?
Well, you know what, Dr. Farran? I don't think we're that close because we have to get out of the mindset of only wanting to make the money. Again, like I said earlier, we have to make sure that we are treating the people that are attached to the teeth. And until we get to that concept of understanding that there are people attached to these teeth, I don't think we're that close.
Well, if anybody's going to make us all get closer, it's going to be you and your amazing karma and energy. I've done 1,000 podcasts. You're the only one who has lit candles during the podcast.
How do you like that Zen? Do you like
that?
I
love it. Read all these things behind you. What does it all say? Live, joyfully, laugh. Read some of them.
The happiest people don't have the best of everything. They just make the best of everything, right? Well, and then you have love affectionately, live joyfully, listen carefully. I am all about listening. That is one of my whys. I am all about listening to people and giving people a voice. And hug tightly, and what else? Forgive freely. We talked about that early. You got to forgive.
Well, for the record, I contacted Erin. She did not contact me. This was it was a huge honor. I love your website, Text for Teeth. I hope you contact her. I hope you have her come in your office, speak to your next group. I hope you make an online CE course for Dental Town. Love everything about you, Erin. The only thing I don't like about you is that your football team, you should only be supporting the Arizona Cardinals.
Right? Okay. Well, I'll do that. I'll go get a hat today. How about that?
You'll get a Cardinals hat just for me. But thank you for all that you do for your patients, for dentistry, and it was just an honor and a privilege to be able to podcast interview you.
Thanks for having me, Dr. Farran. I appreciate the opportunity. Thank you so much.
Okay, well, always call me Howard because Howard.
support.
All right. And thank you, Ryan. Thank you so much, Erin. I hope you have a rocking hot day.